This new study says 12 million Americans misdiagnosed each year. How serious is that?
It's very serious, Alex. Medicine is a very high stakes game. And when you have numbers like 12 million Americans, it sounds like a lot, and it is a lot. It represents about 5% of the outpatient encounters. So there are hundreds of millions of these encounters, and yet about 95% right. You would think that would be great on a test for history, but it's not good enough for medicine, especially when lives are at stake. They estimated about half of those 12 million misdiagnoses could lead to serious outcomes.
What are some of the reasons that this happens?
There are lots of reasons. Some of them have to do with patient factors, some with doctor factors, and a lot of them with the interaction between doctors and patients. Now, doctors' visits these days tend to be rushed, just not having enough time to talk to the patient, to communicate, to get a sense of what's going on. That's a big problem. I had a Dr. Al Markowitz, who was a mentor of mine, Dr. Al Markowitz, and he used to say, if you let patients talk long enough, they'll actually tell you what's the matter. And these days, you're in, you're out, and that's a problem. There are a lot of things that the doctors need to do. We need to make sure that we follow up on abnormal results. We need to make sure that we're really listening. From the patient's point of view, there are definite things that you can do. You can do your homework. So when you come in there, think about your history beforehand. How am I going to tell it in a concise way? Start from the beginning, go chronologically, try not to skip around, tell a story, because as the physician, I'm listening to you. I'm listening for clues, and I'm trying to figure out what exactly is going on. And I can't figure it out unless you tell it to me. Again, in terms of history, you should figure out your family history. Is there a family history of cancer? That may increase my suspicion that something's wrong if you have a certain symptom. And then also just I hate to say this as a physician, but be a little aggressive as a patient. You shouldn't just assume that we're going to come back to you with a result. You don't hear the result of a test you did, call. Don't assume that if you don't hear anything that it's good news. No news is not necessarily good news, and that's been shown.
What are some of these symptoms that aren't being correctly identified?
In one study, 40% of the symptoms that were missed were either cough or abdominal pain. And that makes sense to me as a physician, because somebody comes with a cough, we can assume it's a cold. On the other hand, maybe it's something more serious like lung cancer. If somebody comes with abdominal pain, belly ache, so many things are a belly ache. It could be you ate something bad, or it could be you have an aneurysm. It could be you have colon cancer. And the art of medicine is trying to figure out which one of these symptoms, which may be 99 times out of 100 is something innocent, 1 times out of 100 it ends up being something serious. That's the art of medicine. That's the tricky part about it. And I'll tell you, that's the pressure of being a physician, to try to figure out when somebody comes in, to really take everybody seriously, try to communicate as well as you can, and then try to put it together.
Dr. LaPook, thank you.
Pleasure to be here, Alex.